Hi, welcome to our presentation on Medicare. All right, a single payer system, or Medicare for all, would mean the end of private health insurance in America. The government would foot the bill for the plan, with most proponents of the system, like Bernie Sanders, arguing for a progressive raise in taxes to pay for free healthcare. With Medicare for all, no American would have to pay much out of pocket for surgeries, doctor's visits, drugs, and the plethora of other costs associated with healthcare. They would all be covered by the government program. Private health insurers in America make tens of billions of dollars in profit every year, and don't want to let go of their hold on the industry, recently mobilizing armies of lobbyists to try and kill Medicare for all as it grows in popularity in the United States. The case for a single payer Medicare for all system is usually based around the problems with our current industry and the success of the program in other countries. Under our current private healthcare system in the United States, 45,000 people die a year due to inadequate healthcare coverage, 500,000 go bankrupt due to health costs, 32 million are uninsured, and we pay by far the most for healthcare of any other country in the world, around $10,000 per capita, where the average in comparable countries sits around half that. We pay exorbitantly for a system that gives us the highest rates of avoidable deaths, chronic diseases, and the lowest life expectancy of other highly developed countries. Universal healthcare systems have been implemented in other countries like Denmark, the UK, and Canada for decades with much success, and it has garnered large popularity in the United States, with 69% of Americans supporting it. Supporters cite greatly reduced overall costs for consumers for healthcare and drugs, the saving of countless lives, and greater ease of use as key benefits of a single payer system. Many have also seen the recent rise of the coronavirus pandemic as a call for universal healthcare, with mass layoffs causing millions of people to lose their employer provided health insurance. Medicare for All does face an uphill battle, with many critics arguing for a free market approach to insurance. It also finds little footing in the political establishment, with Joe Biden only supporting a public option for healthcare.
Despite the many advantages of universal healthcare, Medicare also has its downsides. The government devotes nearly 15% of its budget, or nearly $740 billion, to administering Medicare. Healthcare is an imperative part of our society, yet many argue that 15% is far too large when considering which other programs could be funded, for example, education, mental illness cures, and social justice. This is an immense component that causes some to doubt the worth of the program. Looking toward the future, by 2050, the population of over 65 years old will be nearly doubled. This means an increase in heart disease, cancer, stroke, and dementia, all very expensive diseases with increased hospital stay costs. The New York Times predicts that the current trajectory of the system is unsustainable, and that spending nearly $1 trillion on medical expenses will do far more harm than good. The cost of hospital stays remains exceedingly high regardless of Medicare enrollment. Medicare is partly responsible for these high rates because a significant proportion of those enrolled in Medicare are hospitalized for preventable conditions. These stays raise rates for other patients not on Medicare, and this places a huge burden on the hospital and patients all around. Another downside to Medicare is that those on Medicare past the age of 85, on average, spend far more than younger enrollees of Medicare. Intuitively, this works because as one ages, their medical complications also rise. Yet some argue that this should be better prevented, and instead, Medicare should take into account the later rise in medical complications. One solution to this would be raising the price of Medicare all around, instead of individually as one ages. In addition, Medicare does not contribute to long term care. This is extremely problematic because everyone over the age of 65 years old has a 70% chance of needing long term care in the future. This goes with the very common myth that Medicare is free. Medicare is not free. Everyone pays something called Part B medical services and supplies insurance premiums, which on average is $135.50 a month. Unfortunately, Medicare has also been used by many fraudulent doctors. A recent example of this was in 2017 when 412 doctors were charged with medical fraud. According to the New York Times, the healthcare providers billed Medicare and Medicaid for unauthorized drugs, assumed money for false rehabilitation treatment, and illegally sold prescriptions. Overall, there are both exceedingly impactful upsides and downsides to the program. Because healthcare is such a substantial part of our society, it is unlikely that Medicare will be dismantled entirely. Yet, for it to continue in a sustainable way which truly benefits all, many changes must be made.